St. Mary's mission is to improve the quality of life of children and families with special healthcare needs. We serve some of New York's sickest children, children with complex medical problems who've been in hospitals and who need ongoing care after they leave the hospital.
On a deeper level, it's about taking advantage of all existing talents, emerging technologies, opportunities for innovation and creativity, partnership with the families and the patients themselves to continually advance the quality of life of all individuals with special healthcare needs.
St. Mary's is one of the few organizations that has this full continuum of services, where a child coming out of a hospital could get care in our inpatient facility, then move to our medical daycare program, and then ultimately get care in their home. Because we have support of our donor base, we're able to dream and to innovate. Just in the last year, we finished our new 21-bed unit and are able to care for 25% more children than were a year ago, both in our inpatient program, but also that expansion included the opportunity to add more children to our medical daycare program.
Last year, our daughters, Rahima and Halima, were in two different hospitals. Halima was in Westchester while Rahima was at St. Mary's. It was really complicated to go from one to the other. Last year, St. Mary's was able to expand and add another unit on the other side of the building, and they told us they're going to be able to share a room and become roommates. They get to laugh with each other, cry with each other. Our quality of life is so much better.
Having St. Mary's support for us has enriched Michelle's life incredibly. They understand Michelle in some ways more than we do, because she's here most of the day. She has another home, another family. We're so happy that she has this.
Recently, we've begun a number of new programs. The flagship new program we started is our Neurorehabilitation Locomotor Training Program.
Dennis has made such gains since he started. When he came to us, he said, I have some sensation in one of my legs, not so sure of the other. He thought he was wheelchair bound. We're now opening up this new realm for him.
When I first started the walker 6 months ago, I was only able to walk 15 to 20 feet. And just yesterday, I walked 100 feet without a seated break. It gives me a lot of hope to continue to improve my daily life.
It's been rewarding to show him that his recovery is still possible, and he's miles further than he ever thought that he would get.
It really excites me to be part of the process as the therapy program grows and seeing more patients come in and recover just like I did.
Over the past year, the rehabilitation department made an enhanced focus on mobility through all of our programs. The first was a research study that launched called Trexo, which is a gait trainer with attached robotic legs. This is a new way to gain access for patients who may or may not have been ambulatory prior, allows them to get into this device and gives them access to the world in a different way.
My daughter, Aaliyah, is non-ambulatory. We've done everything from hippotherapy to PT to aquatherapy to extensive physical therapy to help her with her natural gait. Now, being in the Trexo, she gets to feel that motion that we all feel and has the time of her life doing it. Leah's 10 years old and she's been through 5 surgeries and 3 feet surgeries. To see her in a device that's allowing her to walk and just to hold her hand, put my hand around her shoulder. As a mother, you can't put words to that, to see your own child actually doing the one thing you always wanted to see her do, and knowing that she's doing it is truly a blessing here at St. Mary's.
It brings us to our knees just watching what children can achieve, watching them light up, watching their families come away with new hope. The energy they have, the resilience they have, they will keep driving us, just driving us forward. Every time we have a solution, we're driven again to tackle the next problem, and that we can assure it every single step of the way that we've done our best.
Special needs parents do so much for their children. It just gives us that place of rest, knowing that she's here and that she's doing her very best and that St. Mary's eyes are all around her.
The work that St. Mary's does is never done. We're always looking to do more for the kids and families that we serve. In order to be able to do things that make these kids' lives even better, we need support from the donor community. We're so grateful to be partners with you in doing this, and we look forward to continuing that partnership for many years to come.
When you walk through our halls, you will see overflowing hope and resilience. You will see milestones celebrated, some small, some immense. Every single person that walks through our doors leaves changed in some amazing way.